The enterovirus, it has been around for a while, but one particular strain, Enterovirus D68, has spread quickly and has infected nearly 200 children across the country. Joining us to share more about it and how to stay healthy is Dr. Michael Cloddy, pediatric infectious disease specialist at Bay State Children's Hospital. Dr. Cloddy, thanks for being here this morning.
Thank you for having me, Ashley.
This is one of those things, especially for parents, because it has affected children, that you want to be informed and know about, because God forbid your child has it, you want to know what to do and how to take the correct precautions and measures. Let's talk about what it is. Now, this has been around for a while, the enterovirus.
That's correct. And in fact, this particular strain was initially discovered in the 1960s. But commonly every year we have enteroviruses that circulate between the late spring and late fall, through late fall.
Now, what is it about this particular strain that has really got people talking?
So what we've seen with this strain in particular has been its rapid spread across the country, and the kind of disproportionate amount of symptoms in terms of respiratory difficulties, children having difficulty breathing with this particular virus.
Now, I know there's a lot of talk, and I just hear it among parents myself, you know, oh gosh, my kid is sick, I hope it's not the enterovirus. We need to know what are the symptoms, what are the signs that it could be that, and not just the common cold or flu.
Right, and so actually in a large, overwhelming majority of cases of children that are infected with Enterovirus D68, most of it will be similar to a common cold. And so in all likelihood, you won't even seek medical care for it. But in terms of children with underlying respiratory issues such as asthma or other lung diseases, parents should be keeping a little bit closer eye in case they notice that their children are having more trouble with breathing.
Now, this is something that, you know, you don't want to have to think about, but if you're in the moment and your child is having trouble breathing, should you immediately call 911? Would you suggest that?
Well, certainly I think it's important that your pediatrician, your child's pediatrician, be your initial line of defense. I like to tell my parents of patients that I have that, you know, you are always the best judge of your child's health. And if you believe that your child is in significant trouble in terms of work of breathing, then it is always best to contact 911. But in general, your pediatrician should be your first call that you should make.
Right, and so bring them to the doctor. Don't hesitate, and it's never not okay to bring them to the doctor. So I guess when in doubt, just make an appointment and bring them.
Of course.
To be sure they're healthy. Now let's talk prevention. We all know, we hear it, wash your hands, and still people just seem to think that it's not important.
Yep, and especially for people on the go, I know nowadays that a lot of people use the hand sanitizers, and we always say that particularly with this type of infection, this enterovirus, that the hand sanitizers are better than nothing, but obviously in terms of hygiene, good hand washing for at least 15 to 20 seconds, particularly after changing children's diapers, wiping their runny noses, is particularly important to prevent the spread.
Take time to do that, especially if your child is around other children, or maybe you're headed to the Big E, you're having fun, and let's face it, we're all gonna go, we're all gonna have fun as a family, but be extra careful that you are washing your hands.
That's correct.
And your kids as well.
Yes, absolutely.
And that you do take those safety measures to make sure that no one does get infected. Well, I think the bottom line, what is it that we all should know, whether we're a parent or just a member of the community? What should we know about this enterovirus, this particular strain?
So, in particular, I can't emphasize enough that in an overwhelming majority of cases, the symptoms will be extremely mild, and it will be nothing more than a common cold. And so, in terms of public fear and public concern, you know, I think that there shouldn't be a significant amount of public concern.
Right. So just, you know, obviously take care and take the safety measures you normally would.
Correct.
And above all, it's just important to be healthy.
Yes, absolutely, Ashley.
Thank you for your time this morning.
Thank you so much.
Wonderful to have you here. Enjoy your weekend.
Thank you. You too.
Still